What is common between Kriti Sanon, Shruti Hassan, Tapsi Pannu, Vidya Balan, and Shilpa Shetty? All of them have at some point in their lives struggled with PCOS or polycystic ovarian syndrome. Today, we shall discuss in detail what is PCOS, how it can be diagnosed and managed. Hello and welcome to Fertility Talks by Kiran IVF. This is an initiative to spread awareness about the causes of infertility and how it can be managed. So, my first question is to you, Dr. Pratima. Are PCOS and PCOD the same?
Thank you, Dr. Samit, for the question. Obviously, PCOS and PCOD are not the same. PCOS is polycystic ovarian syndrome, and PCOD is polycystic ovarian disease. So, when the disease is located only to the ovary, like it is presenting in the young reproductive women with anovulation, and then she presents with fertility, this is called PCOD. But when you have the cascade of events which affects the other endocrine organs and other cardiovascular and other organs involved in the body, then it becomes a syndrome.
So obviously, as it is related to the ovaries, it can only occur in women. What percentage of the population is affected by it?
The incidence of PCOS and PCOD has increased in the recent past because of the lifestyle changes affecting women in these days. So the incidence is as high as 20 to 22% in India and worldwide around 15%.
So Dr. Kiran ma'am, can you tell us what are the common symptoms associated with this condition?
The most common symptoms associated with this condition of PCOD and PCOS is usually to anovulation, that is lack of release of egg every month. The woman will experience irregular menstrual cycles. Sometimes it can range from oligomenorrhea, that is a medical term. But in a common language, I can explain that they would have irregular periods once in 2-3 months, and sometimes they may be totally absence of periods also. The second common symptom would be acne on the face, that is due to high levels of androgens, which are called as pimples, and they may leave black scars also. The other symptoms are that, they will have alopecia, that is loss of hair, and a male type of baldness may occur. They will become obese, that is slowly they will put on weight, and then they will actually have a very high BMI, that is body mass index of as high as 30 also. Other symptoms would include lethargy, sluggishness, and sometimes they may have other hyperandrogenic symptoms also. What other symptoms matter to an infertility specialist is that they will come with the infertility history, and then they are not able to conceive a child after they are married. That will be one more symptom, and cyst in the ovary on ultrasound. The common symptom with which they walk into the infertility OPD is that they are not able to conceive after married life for 2 to 3 years also. And when we diagnose them and do an ultrasound, it will be showing actually polycystic ovaries. So that confirms our diagnosis.
So Dr. Shravati, what are the common causative and risk factors associated with this condition?
The exact cause for PCOS is still unclear. It can be due to a combination of genetic, hormonal, and lifestyle factors. Coming to the genetic factors, PCOS tends to run in families, suggesting a genetic predisposition. But the specific genes contributing to PCOS is still being studied. Coming to hormonal factors, PCOS women are more resistant to insulin that is in the body, leading to more level of insulin in the body. This leads to abnormal production of LH and FSH from the pituitary, causing hormonal imbalance in the body. This leads to excess level of male hormone, that is androgen in the body, leading to features like hirsutism, that is abnormal hair growth, like male pattern type, like beard and chest. So these contribute to hormonal factors. Coming to the lifestyle factors, obesity or overweight can contribute to PCOS by worsening the insulin resistance. This is due to increase in the level of leptin that causes the body to resistant to insulin. And sedentary lifestyle also very important point that leads to obesity or overweight. Coming to diet high in processed foods and unhealthy fats, lean proteins, all these contribute to lifestyle factors leading to PCOS. Other factors can be low grade chronic inflammation in the body can also contribute to PCOS. And also exposure to environmental toxins and poisons can lead to PCOS. And vitamin D deficiency plays a crucial role in producing the symptoms of PCOS. So all these factors contribute to PCOS. The exact cause we cannot say.
So that was the causative and the risk factors. Now, Dr. Kiran, can you tell us when a patient walks into your office, how do you diagnose her that, oh, yes, you have PCOS? And do you categorize it as mild, moderate, and severe?
Yeah. When we first time see the patient in the OPD, there are certain phenotypic features. Phenotypic features means, the her appearance and the other physical changes which occur in her body would be indicative of polycystic ovarian disease. The first and foremost feature can be the 70% of these girls would be overweight and obese, and their BMI may be ranging which is more than 25. And the other facial feature which is pointing towards PCOD would be hair on the face. That is a male type of beard. They would sometimes have hair on the chest also when you examine her closely, and hair on the back. There is other indication is acanthosis nigricans. This is a medical term wherein you will have very black line-like areas on the back of the neck or on the nape of the neck. So that also points towards PCOD diagnosis. So certain physical features when they come in, and when you examine her with the pelvic examination, with the pervaginal examination, ovaries, if they are very large, that is when it comes in the category of severe PCOD, they would be also felt by your finger examination. But the gold standard would be that you do a pelvic examination with the help of the transvaginal probe. That is, when the transvaginal probe is introduced inside the pelvic cavity, you will see that the ovaries are pathognomic of this condition. Both the ovaries will be very much enlarged in size, 2 to 3 times their original size. The volume of the ovary will be increased, and a very typical feature would be the cysts. That is the name itself indicates polycystic ovary. This cyst will be arranged in the periphery of the ovary like a necklace pattern. So this is very pathognomic, and then there are certain features which help us to decide mild, moderate, severe. I won't go into the details of that, but as the condition severity increases, you will see cyst numbers increase, and the stroma also will be increased. The connective tissue of the ovary will be increased, and the blood flow to this stroma also will be increased. So those are the features which are the very pathognomic and very diagnostic. And of course, then you have the minor features like, the obesity pattern, and then the hormonal changes and all when we do the other investigations. Yeah, as such, there will be a big battery of investigations which we can carry on to diagnose. But what I would stress on 2 levels, which every girl knows and should know about herself, is what are the AMH levels when she is married and she is in the reproductive age group. They must know how much is their anti-Mullerian hormone level. This level will be higher than 4 nanograms or 5 nanograms if it's a PCOD, and it may go up to 11 to 12 nanograms also, and sometimes even higher. Other hormone which is drastically increased in PCOD girls is luteinizing hormone or the LH hormone, and this is because of the chronic anovulation. The FSH will be reduced, that is egg numbers which are going to grow and make the baby will be reduced, but the LH hormone will be increased. So if these two figures, if we remember, that is enough for us.
So, Dr. Pratima, does it happen that you usually don't suspect a patient to be suffering from PCOS, but you do an ultrasound and find out that she's, suffering from moderate to severe PCOS? Does it happen? Can it occur without any symptoms?
Yes. Many a times patients do not realize that they have an underlying disorder called PCOD, and the age just passes by. So a lot of women who've been married in the reproductive age group comes to your clinic and says, "Doctor, I've been trying and I'm still not conceiving. Doctor, I'm just putting on weight without even realizing how it's happening. I've been working out, I've been having an active lifestyle, I eat healthy, but still I'm just gaining on weight." So then you suspect that, okay, there is some kind of a disorder that is underlying and it's affecting her ovaries and her metabolism. And when you suspect such, and she comes with such symptoms, do put her to an ultrasound test, diagnose whether she has PCOD. And obviously when she's telling you these symptoms, there might be a milder form of PCOD which is causing her these symptoms, but she will not be diagnosed till you perform an ultrasound and make her realize that, okay, you are suffering from mild to moderate PCOD. You need some medications to get, to overcome this insulin resistance. And then hence, you can induce ovulation, and then subsequently she can conceive, and her weight gain can also be taken care of.
Dr. Kiran, we discussed about, weight gain and there being an increased tendency to put on weight in such women. What is the concept or the reason behind this?
Yeah, the reason behind the complex metabolic changes taking place in her body is actually manifold. What happens is whenever they have PCOD, they become anovulatory. That is, they are not producing an egg. and they are not producing enough female hormone, which is known as estrogen. In the absence of estrogen, what increases is from the thecal tissue a hormone called androgen, which is a male hormone. Now, what this hyperandrogenemia does to the whole system of delicate system of hormonal balance is it increases the insulin levels, and in turn, increase insulin levels in turn again increase the androgen levels. And increased androgen level or the male hormone also suppresses the ovulation. So this is like a vicious cycle. It goes on like that unless you break it in the somewhere with the help of a surgery or medicines and all. That is secondary, but what I would like to tell you is that this insulin plays a very crucial role in our body. It is actually the one which controls our sugar metabolism, our energy levels, and also keeps us lean. But here there is something like a starvation amidst plenty. Insulin is so much high if you test by the blood levels of insulin, but this insulin is not able to work on the cellular level. So the cellular level, it doesn't act. The blood sugar will be increased in the blood because it is not being utilized by the cells. So this is a complex type of a mechanism which has to be broken somewhere, and the insulin level being high also is not good for our system, and it leads to obesity.
So, Dr. Shravanti, you might have two kinds of women approaching you with PCOS. One who might not be married, younger age group, adolescents, versus somebody who's married and infertile. Before give them some treatment, what kind of lifestyle changes would you recommend in these patients?
Lifestyle modification plays an important role in reducing the symptoms and severity of PCOD. Even weight loss of at least 5% can result in improvement of symptoms, resumption of normal menses, and improvement in fertility. So, weight loss management has to be taken by adjusting diet and having regular exercise and stress management. Coming to the dietary advice, a balanced diet consisting of fruits, vegetables, and low carbs, high proteins, and healthy fats will contribute to dietary advice. Limit refined carbohydrates like white flour, rice, potatoes, and sugary drinks. And consider low glycemic index carbohydrates. And also consider high fiber diet, that is rich in fruits and vegetables. Always consult a dietitian to have a personalized dietary advice. Coming to the exercise, at least 150 minutes of moderate degree aerobic exercise per week is essential, or 75 minutes of vigorous activity is essential per week. And always start with a small manageable procedures and then slowly progress to high intensity and more duration workouts. Strength training exercises are important and should be done twice a week. So this regular exercise is important as a modification. Coming to the stress management, yoga, meditation, deep breathing exercises will help you a lot in releasing the stress. And always engage in relaxing activities like listening to the music or enjoying with your loved ones to relieve the stress. So all these lifestyle modifications will play a crucial role in improving the symptoms and in resumption of normal menses and also in improving the fertility.
So, Dr. Pratima, does PCOS also cause miscarriage? And what role does metformin play in preventing?
Yes, miscarriages is something which is very, very hurtful for a PCOD patient. And once a patient gets pregnant and lands up in a miscarriage, it actually shatters her dreams. Now, this happens because PCOS ends up with 50% more chances of miscarriage. Why does this happen? This happens because of the abnormal hormonal milieu that the body has in this woman. So basically, the most important hormones that cause miscarriage in a PCOD patient is the increased levels of androgens, the increased levels of luteinizing hormone, and the increase in their insulin resistance. Now, all of them play a vicious cycle and then ends up in an abortion or an early miscarriage. The higher levels of these hormones or the hormonal imbalances affects the quality of her egg, affects the internal environment, the uterine cavity, affects her endometrial cavity, and affects implantation. This is how she ends up in an early trimester abortion as early as 10 to 12 weeks. As we all know that metformin is used for type 2 diabetes mellitus, but it is being used for treatment of PCOS and PCOD in women with anovulation. Now, metformin is a wonder drug. A small tablet or a small dose of, as 1000 mg given to a young woman with anovulation, with insulin resistance, with increased androgen levels, and probably with an abnormal hormonal milieu, would correct her, anovulation. She will start ovulating every month. Her periods will get regular, and with this, she will start, there will be chances of her getting ovulation and subsequent pregnancy. Second, what metformin does is the increase in insulin resistance is taken care by metformin. The blood sugar levels are controlled, and hence her weight, which is, randomly she puts on weight because of her insulin resistance, is also taken care of. And studies have shown that metformin in the early and the late stages of pregnancy, up to around 28 weeks, prevents the chances of miscarriage and a better pregnancy result.
So, Dr. Kiran, we've heard about the medical management. What is the surgical management of PCOS and when it is indicated?
The management of PCOD can be divided into medical management and surgical management. Medical management we have heard earlier. Now coming to the surgical management, directly addressing the problem is to remove the cyst physically with a laparoscopic method has been in vogue for the last 30 years. When the laparoscope actually became more advanced, the treatment which is called as multiple punctures of the ovary was undertaken to correct this disorder, wherein all the cysts which were there were punctured with a needle having a kind of a cautery attached to it, and then it immediately gave results. Like the LH levels which were very high, the hormonal imbalance was corrected. The patient started ovulating on her own. Spontaneous ovulation was recorded in 50 to 60% of the cases. Because the LH levels were lowered and the other hormonal milieu was taken care of, the body weight also dropped, and most of the patients came back with pregnancy in 30 to 40% of the patients. But slowly this procedure also has taken a backstage now when IVF has come in. Now the other surgical option which you asked me is about the bariatric surgery or weight loss surgery, wherein we reduce the size of the stomach, wherein the food intake by the patient will be actually brought down to about 1/4 of what she was actually consuming, but she has to maintain her nutrition in this stage also. And if the moment she loses about 10% or 15% of her body weight, like she's very excessively weighing earlier, this would actually bring about a very favorable hormonal change in her. She'll start ovulating, her insulin levels will be corrected, and the pregnancy outcome may be also better. So these two surgeries are good surgeries.
So now that we've learned how to manage PCOS, let us understand from Dr. Shravanti what happens in case you don't manage it and if it is left untreated.
PCOD is a considerable cause of infertility in women. If left untreated, it leads to increased risk of miscarriages, as Dr. Pratima said, and it leads to a number of pregnancy complications, leading to increased risk of gestational diabetes, gestational hypertension, and neonatal complications like small for gestational age and increased admissions to the NICU. So, coming to the long-term complications, if left untreated, PCOD can lead to long-term complications in different parts of the body. Like there will be increased risk of diabetes mellitus and hypertension and dyslipidemia, that is abnormal cholesterol level in the body, and stroke and cardiovascular events risk will be increased. Non-alcoholic fatty liver disease, obstructive sleep apnea because of obesity, and even the quality of life is decreased due to psychological and behavioral disorders like depression, anxiety, like that. And coming to the gynecological aspect, it leads to increased incidence of endometrial hyperplasia and almost 2 to 7-fold increased risk of endometrial carcinoma in old age. So all these long-term complications it can cause. So it needs to be treated early. Early diagnosis and treatment will prevent the long-term complications.
So, Dr. Kiran, what is the role of IVF in treatment of PCOS and vis-a-vis IVF and ICSI? Which option do you suggest to the patient?
In vitro fertilization or test tube baby technology is an excellent option for patients suffering from PCOD. We have to definitely offer them this option whenever they have a married life longer than 2 to 3 years, and the various other methods of treatment have failed, that is ovulation induction. Because here we are directly taking care of what is the cause of her infertility. We are directly taking care of her anovulation, and we are giving her injections to make number of eggs, which are very useful for us to form good number of embryos, and we are directly putting it inside the uterine cavity and we are not depending on the natural phenomenon for the pregnancy to occur. ICSI is a very good option. ICSI in the term I will explain, that is intracytoplasmic sperm injection, wherein sometimes the egg, the thickness of the egg wall may be little thicker in the PCOD patients, or there may be certain other factors also contributing to less rate of fertilization. So whenever we put the sperm directly inside the egg, this procedure gives us a very good embryo formation. And whenever we transfer those embryos back in a proper hormonal milieu, that is, her own hormonal milieu is always disturbed. So whenever in an ideal situation we transfer these embryos, the pregnancy rates of as high as 70% can be achieved.
Right. So now we've seen that IVF is one of the best treatment options for PCOS. But does a woman with PCOS opting for IVF, does she have to watch out for certain symptoms, certain conditions, certain complications that can occur? Let's find out from Dr. Shravanti.
So we need to consider certain factors when we are going for IVF in PCOS women. Usually, PCOS patients will have abnormal hormonal imbalance in the body, leading to increased male hormone in the body. So this leads to this causes impact on the egg quality and ovulation. So that results in low fertilization rates and increased risk of miscarriages. So proper lifestyle modification is equally important, and certain medications like metformin can be given to improve the ovulation and egg quality. So PCOS women will have an increased risk of OHSS, ovarian hyperstimulation syndrome, due to ovaries over-responsiveness to the stimulation procedure. This is a self-limiting disorder and it resolves spontaneously within a few days. It can range from mild to severe. Mild OHSS can be treated on an outpatient basis, and severe form includes the fluid accumulation in every part of the body, but this is very, very rare and it is seen in less than 0.5% of the stimulation protocols. So, prevention is better than cure. So, we need to prevent the onset of OHSS, that is ovarian hyperstimulation syndrome. So, in order to prevent OHSS, we follow mild stimulation protocols and elective freezing of embryos and several other strategies to prevent the OHSS.
So, Dr. Pratima, patients often ask, does PCOS ever go away or is it a lifelong disorder? And if they do reach menopause at the appropriate age, does PCOS go away at that time?
Well, there is no cure for PCOS, but yes, as we all know, menopause is the onset of, it is a decline, it's basically a decline in all the reproductive hormones in a female. And PCOS being a reproductive age disorder, wherein it's linked to sex hormones or the reproductive hormones. Obviously, when there is a decline in these hormones, the symptoms that a woman carries throughout her reproductive age obviously come down, the intensity goes down. Obviously, there is not going to be ovulation around the menopause. So all these symptoms will definitely come down when she reaches her menopause. But if she still has some symptoms and that's disturbing her, or it's affecting her lifestyle, or it's affecting her day-to-day routine, then she should obviously reach out to a healthcare provider, her gynecologist, and seek for proper treatment.
So, Dr. Kiran, we know that PCOS causes infertility, but do you have patients who you've seen in your experience that they have PCOD, but they get pregnant naturally?
Yes. The moment the diagnosis of PCOD is pronounced in front of the patient or her parents or in-laws and everybody, the family walks in, the girl need not go in for depression or despair, because it's not a treatment which is not available nowadays. It's lots of methods are available, and sometimes I have seen patients walking in with a spontaneous pregnancy also, because what has really happened is only her ovulation rate throughout the 1 year of duration or 2 years of durations has come down a bit lesser than the other girls. So whenever she does some lifestyle changes or takes some ovulation induction agents, or even without taking them also, they can spontaneously become pregnant also and come to your OPD. So in this modern era, there is with lot of treatment modalities available for the patients of PCOS. One need not be always having a pessimistic approach, and then they come to a healthcare provider or infertility specialist or a gynecologist. Lots of options are available, and I'm sure that they will benefit from it.
So, Dr. Shravanti, prevention is one of the key words in modern medicine, right? So, Are there any steps patients can take to completely prevent PCOS?
There is no proven way to prevent PCOS, but we can take certain simple steps to control the symptoms of PCOS, like maintaining a healthy lifestyle, like eating nutritious diet, doing regular exercise, and maintaining an optimal weight. So these will control the symptoms of PCOS.
So we've discussed a lot in great detail about PCOS, how you can diagnose it, how you can manage it. Dr. Kiran, do you think this condition affects society at large, and why it is important to understand it, why it is so important to manage it, and your concluding thoughts on the same?
Yes. This term of PCOS or PCOD was unheard of in our earlier medical profession days, where it was a very rare diagnosis. Only 2 to 3% of the girls we used to say were getting affected by that. But now this term has become a household name. Every girl knows about PCOS and PCOD because of the social media talks about this, the newspapers, the women's forum. Everyone talks about PCOS and its harmful effects on the women or girls' health. So once you are aware of this condition that this may be affecting you also, it's better always to get a checkup done with the ultrasound examination whenever you have irregular periods or whenever you're having excessive menstrual bleeding, or your work days are being actually cut short by these kind of disadvantages because of the high BMI, increase in your weight, insulin resistance, acne coming on the face. So all these things disturb a girl. So once you are aware of this, that this condition may be leading to these symptoms, I think most of the girls would come to a gynecologist or to a healthcare provider and ask whether any diagnostic tests are there, doctor. Can we undergo this test, and can you exclude that I have any PCOD because I have symptoms like this? So that's a very good positive approach. And in this modern era of science, where everything is available to most of the girls in the cities, and now in the other rural areas also, these health services are being provided. I would actually tell all the girls in the adolescent age group or in the reproductive age group to come forward. There is no nothing to feel shy about it, nothing to be feeling why should we go and get investigated by PCOS. If you think it can affect your health, definitely come forward and consult the infertility person or the gynecologist, anybody, and then get your doubts clarified. So I would actually put it in a positive way only. And prevention is, as I said, 100% prevention is not possible, but if you can control your disease and keep it under control by controlling your weight, by your lifestyle changes, by your dietary changes, by decreasing your stress, and always being aware that this condition is there in me and I must always keep it in control, you will be preventing complications like heart disease, you'll be preventing complications like diabetes, you'll be preventing excessive body weight, hypercholesteremia, and all these hypothyroidism. Sometimes the thyroid also gets affected by PCOD, and your facial features may be disfigured because of this more hair on the face, baldness. So all these physical aspects as well as the internal milieu aspects can be taken care of by a girl who's intelligent enough to understand what her problem is and how to tackle it. All the help is available for her.
So there you have it. We have discussed in great detail about PCOS, what it is, how it can affect people, how it should be diagnosed and managed, and why it is so important for the society to be more aware of this condition and take steps to control it. Thank you for joining us, and we hope you continue to support us. We will be back soon with a new topic of discussion. Thank you, everybody.
Thank you.